Debbie Seidel Bittke, and I'm here with our last training video in this series on 5-star dental hygiene care. And this week we're talking about dismissal of your patient. I have a few suggestions that will keep you running on time. So let's go through this together now. I'm also calling this the hygiene handoff because it's this point in time the hygienist is speaking to the patient about what was completed during their hygiene appointment. I believe it's important for the hygienist to make at least one of the patient's next hygiene appointments. And the reason I say that is because the hygienist is the one auxiliary that just spent so much time with the patient, and she or he understands what the patient needs to return for as far as future hygiene appointments. So it's the patient is there, the hygienists are reviewing what was completed and why the patient needs to schedule for their next hygiene appointment. So it just takes 1 or 2 minutes at the maximum for the hygienist to do that, and now walk the patient up to the front desk and hand off that patient to one of the auxiliaries seated at the front desk. And it just allows your patients to perceive a high level of patient care. It provides an opportunity for more elegant and effective communication. It just continues to increase rapport with your patient. And it also is very helpful when you can have the hygienist transition that patient to the front desk, where the front desk can now make future appointments. The hygienist is going to communicate what doctor wants to see the patient back for. Maybe next week the patient needs to come back for some restorative needs, and it's an opportunity for that patient to discuss financial arrangements, a plan for payment in privacy. This is how you are going to increase your case acceptance. It's possible the patient has more questions, and if you have a private area where you have a financial coordinator, they can actually talk to that patient in privacy, and this is where you're going to get that yes from the patient to accept care and the ability for them to understand payment arrangements. This is the time where you're going to schedule that patient for their next hygiene appointment, as I just said a moment ago, because it used to be years ago that we just sent our patients a postcard and they called. And what we found out over the years is that by having patients call for their next hygiene appointment to be scheduled, it doesn't add value to why they need to call for their appointment, and it doesn't create urgency. And we ended up years ago losing at least 60% of our patient. It costs the office more time and money getting those patients back into the office. This is how it's going to work. Your hygienist here is going to walk the patient up to the front desk. The hygienist may be standing over here next to the patient, or perhaps like we see in this picture, she's come around to the back side talking face to face with the patient, and also the hygienist can look over here and engage the front office receptionist or team member here at the front desk. And so the patient is Mrs. Johnson today, and this auxiliary seated here is Amy. And it's going to sound something like this. The hygienist is going to look over to Amy and say, Amy, today I completed 4 x-rays, or you might want to say bite wing x-rays if your patient is familiar with what bite wing x-rays are. I completed these x-rays for Mrs. Johnson, and she also had an exam by doctor. Everything looks great. We took her blood pressure, it looks great. I mean, everything's super, and doctor didn't find any areas of decay. However, we wanted to start the whitening today because Mrs. Johnson requested to get whiter teeth. So I took the impressions, and then I just need you to let her know when she can come back in for just a few minutes later this week so that we can deliver the trays for her to start whitening her teeth. And then I explained to Mrs. Johnson that we'll give her some instruction on how to use the whitening trays. I only did a prophylaxis today along with that exam and the x-rays, but I will see Mrs. Johnson again in 6 months. We've scheduled a time on Tuesday, February 4th at 10 o'clock in the morning. I know that's what time she usually comes in, and that works best. Mrs. Johnson, so great to see you today, and I look forward to seeing you in February. And I hope that you'll bring in pictures of your new granddaughter, Amy. She's having a new grandchild. Her daughter's having the baby around Christmas time. Now Amy can engage with Mrs. Johnson in that conversation about her granddaughter as well. I wanted to ask you something. Do you ever go to these shows by Cirque Du Soleil? You're probably wondering, what does that have to do with the hygiene handoff? So be patient, I'm going to explain that. I just love these shows, and anytime that I get a chance to see the shows, I go. But these performers, they're flying through the air, and everything's orchestrated and coordinated, and it's just an amazing experience for us in the audience. If you've ever seen one of these shows, then you understand that it just seems like it's so easy for them. They appear so graceful and like there's no effort, and I've never seen them miss a beat to the music. Just as you can see in this photo, these performers have incredible focus, and their handoffs are impeccable. I mean, imagine they're flying through the air, and if they missed grabbing the other person's hand when they're flying through the air to, fly into the other person's hands, they could die from falling. Of course, there's a net, but they could cause some serious injuries. And you can imagine that your handoffs to the front desk need to be flawless, just like this. Fortunately, our efforts as dental professionals may not be as dramatic as the performers in Cirque Du Soleil, but I wanted to use this metaphor. Do you think that the Cirque Du Soleil entertainers are 5-star? And imagine if you could utilize just some of this information that I provided for you over the last 5 weeks, just implementing a few of these tools and tips. It will make sure that your office is a hit and that your patients become your raving fans. And I want to suggest that after you see this video today, that you practice making your handoffs to the front office ingrained as a part of your team and patient experience. It becomes an unconscious effort, and it creates an unforgettable experience for your patients. Practice is possible that your patients they'll never know that you've practiced so much, but you and your team, on behalf of your patients, bring 5-star patient care when you implement some of these tools and tips that I've shared with you. And I'm certain that if you do deliver this impeccable care, your patients will never forget how you make them feel. You may be known in your community as not only 5-star patient care centered, but the Cirque Du Soleil of dentistry in your community. This concludes our video series on 5-star dental hygiene care. And I believe that if you implement just a few of these tools and these tips that I've given you over the last 5 weeks, you will see that your patients will say yes to your care. They will be happier to pay for their treatment, schedule it, and they will continue coming back to your office. Now, I also have a time management ebook. Hundreds of hygienists have already downloaded this, and I want to invite you to download it as well this week, because I've received wonderful emails from many hygienists saying that this ebook and the suggestions and services and systems in this book have helped them to not feel as stressed during their day. I'd like to hear your comments on what you think about these videos. What do you want to hear about in the future in our training videos? And I hope to see you very soon.